Hello, I hope you're doing well. So, if you watched my last video in ectopic pregnancy, you'd understand why this particular video I'm making right now is very, very important. As a first time pregnant mom, a lot of things can actually go wrong. And it's not because you don't care, or because you're incapable of mothering a child, or because you don't love yourself, or the baby you're expecting enough. Sometimes it's just because you didn't take a particular step at the right time. And yes, there are two different things. It's one thing for you to take a particular step, it's another thing for you to take it at the right time. So both actually matter. And sometimes it's just because you're too excited, you're carrying a baby, like this is your first time, and you can't even imagine, you birthing another life into this world. And you're so overjoyed and you're consumed by this joy that you actually forget to take this particular step. Or maybe you're just that person that's overconfident. You're overly confident. You feel like, oh, there are no issues after all. You're not throwing up. You don't have morning sickness. You don't really have that sign of pregnancy that can actually urge you, to take that step. Or maybe you're just, financially incapable of taking this step. Or maybe you're just this person that's, scared, you're overwhelmed, you're confused. This is your first time getting pregnant. You don't know what to expect. Your emotions are everywhere and you don't even know what exactly to do. Maybe it's an unplanned pregnancy. You didn't expect it. You didn't expect it to come at this particular time. Maybe you had other plans and then pregnancy came. You don't know what exactly to do because you're trying to figure things out and then you just somehow forget to take this particular step. Or maybe you're just that person that doesn't have that sense of urgency. Nothing really bothers you. Even when big things are happening in your life, you take it with a pinch of salt. But in any case, what I'm trying to say is that sometimes it's not really because, you don't care or because you can murder a child or because, you don't love the baby or you don't love yourself. Maybe you already know what this particular step is. Well, your guess is as good as mine because I'm talking about antenatal care. It's a very, very crucial step that every pregnant woman must take to ensure the safety of herself and the baby. So come closer. I know I've been mentioning first time pregnant moms and the likes, but this particular topic also addresses, women that have had more than a child. Maybe it is your second child, your third child, your fourth child, or even your 10th child. This topic actually addresses all of us, including me. Yeah. So there are some of us that would not go for this antenatal care until the 5 months gone and you actually know that you're pregnant. First month goes, second month goes, third month, fourth, fifth. Some would not even go until they are in their third trimester. Some of you are actually watching me. And for real, this is a sister to sister talk. You know yourself, or probably you know someone who does this, who doesn't go for antenatal care until their third trimester. Don't do that again. And that person that you know that does it, tell them not to do it. Tell her not to do it. It's not good for her. Neither is it good for the baby. She might have been getting away with it. Nothing really happened to her or the baby. But now that she knows, tell her to stop. Tell her to stop. And you also stop if you're also practicing the same thing. Because, girl, a lot of people have actually lost their lives just for this particular reason. A lot of people have actually lost their babies for this particular reason. So I'm going to be highlighting the importance of antenatal care. So antenatal actually means before the birth of the baby. Natal is the birth of the baby. Ante is something that comes prior to before. So that's before the birth of your baby. Antenatal care basically means the care that you receive as a pregnant woman during pregnancy until your baby is born. But first, before all of that, once you and your man are already taking inner room protocols, that can lead to you getting pregnant, you need to start doing some things in preparation for the pregnancy. And one of them is for you to start eating well, eat nutritious foods that are rich in vitamins, minerals, proteins, everything in the right proportion. Because now you're going to be sharing your world with your baby, and they're going to be doing that literally because they'll be sharing the nutrients that you get from your food as well. Another thing you should be doing is for you to start taking enough rest, enough sleep, have adequate sleep. One very important step that you must not skip is for you to start taking your prenatal vitamins, especially vitamin B9 that we all call folic acid. This folic acid is extremely important. It's going to help to protect your baby from developing congenital disorders. These are disorders that are actually born, that the baby is born with, at birth. So to prevent that, it's good for you to take your folic acid on a daily basis. And this is going to protect the child from birth defects like neural tube defect. An example of that is spina bifida. This spina bifida affects the spine. It affects how the spine develops, and this can result into issues with mobility, affect the cognitive function. It causes bladder incontinence, whereby the child is not able to hold their urine, and then they just pee everywhere and all of that. It can even lead to blindness, deafness, and a lot of other things, even put them at risk of meningitis, and you want to avoid that for your baby. So please, when you're preparing for your pregnancy, make sure that you start taking your prenatal vitamin, folic acid, very, very important. So back to antenatal care. So a full-term pregnancy actually spans for about 9 months, and this 9 months we split it into 3 months each. So we have 3 months. The first 3 months categorized as the first trimester. The second 3 months we call that the second trimester, and the last 3 months we call that the third trimester. Of all these three trimesters, the most delicate one is the first trimester. I don't want to say the most important one, but it's actually very, very delicate, the most delicate phase, because this is the phase where the baby is rapidly growing, from an embryo into developing body organs, the major body organs like the lungs, you start seeing the heart to the heartbeat, and other organs will start to form. So at this phase, you want to really make sure that you are very, very careful. There's so many things or so many precautions that you need to take at this very phase. And this is why the antenatal care actually starts, in this trimester. Your antenatal care begins within the first trimester, not the second, not the third. The first trimester, as soon as you detect that you're pregnant, you should go register, go book yourself for your antenatal care. This antenatal care actually covers a lot of medical screenings, evaluations and investigations, just to monitor you and your baby to make sure that you both are actually safe and you can go to labor, safely. So they're going to be advising you, because you're going to be meeting with the nurses, the doctors, and even the medical laboratory scientists, and every other health professional that are key to making sure that this actually works out for you, both you and your child. So one of the things they'll be advising you to do is to also, maintain a balanced diet, keep eating well. They're also going to tell you to keep sleeping well, resting well, avoid small strenuous activities that are unhealthy for you. So people actually find some strenuous things, but it's going to be based on case by case basis. So if you're fit to continue doing that, well, fine. But if you're not, you're going to be advised to stop, highly strenuous activity for that period of time. Also, you'll be advised to consider taking your prenatal vitamins. The folic acid is very important before pregnancy and even during pregnancy. It is very, very important for you to keep taking it. Another thing you'll be advised to do is to avoid or abstain from drinks that are, high in caffeine, to stop smoking if you're the type that smoke, or to stop taking alcohol if you're the type that takes alcoholic drinks. And take note, don't say, oh, I don't smoke. I don't smoke at all. But then you live with a smoker, you live with somebody who smokes. Don't you know that you're inhaling the smoke the person is releasing from their cigarette? And that makes you a secondary smoker. You are passively inhaling the smoke, and it is going to affect your baby. So please don't say you don't smoke. If you live with somebody who smokes, you're also putting yourself and your baby at risk. So please move away, stay away from anybody who smokes during your pregnancy period. So at your clinic or hospital, they're going to be running lots of tests on you, like I said earlier. One of them is for them to be checking your blood pressure. It's very, very important. Your blood pressure has to be monitored during pregnancy. There's a particular pregnancy complication we call preeclampsia. This actually comes with high blood pressure and also causes high protein in urine. So they're going to be monitoring your blood pressure to make sure that it is not elevated at any point in time. And even if it is, they can quickly, just intervene and then find a solution for you before it's too late. Another test they'll be running for you is to check your blood level to know if your blood level is actually okay or if you're anemic. Anemia is not actually good for you during pregnancy. Although normally during pregnancy you're going to have a little bit of reduction in your blood level, but it doesn't have to be too extreme. When it becomes too extreme, that's an alarm. So the thing is that your blood actually carries oxygen and other nutrients. So if your blood is depleted, that means that you're not going to be having enough oxygen for yourself or even for the baby. And that's not good for the baby. So they're going to be monitoring your blood level to make sure that you have enough blood supply to supply yourself and your baby too. Also, they'll be checking you for diabetes. There are some people that have never experienced diabetes, they've never experienced high blood sugar, but during pregnancy, they developed what we call gestational diabetes, which comes up during pregnancy. So they're going to be monitoring your blood sugar to check, for any elevation, beyond normal, for them to actually, salvage the situation. Another test they'll be doing for you is to do lots of infection screenings. You know, you don't want a mother to child transmission of any infections, particularly viral infections like hepatitis B, hepatitis C virus, HIV, because this is not even safe for the mother, talk more of the baby. So they're going to be monitoring you to make sure that you don't have such infection. Even if you have such infection, for viruses, like for example, they're going to be giving you antiretroviral drugs, which are going to suppress the multiplication, which we actually call replication of the viruses, such that you're not able to transfer it to your child. In addition, you're going to be doing what we call ultrasound scan, particularly pelvic scan. This is going to be used to examine how well your baby is developing and also to monitor your own condition, particularly your reproductive organ. So for the baby, they're going to be checking the fetal weight, the weight of the baby, checking how well the baby develops, checking the gestational age of the baby. At some point, you'll be able to determine the sex of the baby, but most especially what we are really after is the fetal growth. How is the baby developing? What's the fetal heartbeat? Is the baby's heart beating well at the right rate? This is going to help to detect any physical deformities right on time, before the baby is even born. To check for conditions even like spina bifida, Down syndrome, and every physical anomaly that might have arisen, in the course of the pregnancy. Also, you get to see if you have multiple pregnancies. For example, you have twins, you have triplets pregnancy. You also be able to see the position of the head, the position of the placenta to make sure that everything is actually fine in that space. And also for the woman, they're going to be examining the woman's reproductive organs, for example, checking the womb, the uterus to see if there is no fibroid, even if there is fibroid, if the fibroid is not going to be the type that's going to hinder the pregnancy or hinder the progress of the pregnancy. Also check for other things like, okay, is the pregnancy, is it ectopic or is the baby implanted in the right place? So all of these are going to be checked for in ultrasound scan, and it's better to actually do that early enough in the pregnancy, before it's too late, so that the right intervention can actually be brought in at the right time. Another important thing that antenatal care does is that you're going to be given vaccines. An example, a typical example of the vaccine you're getting is the tetanus toxoid vaccine. This vaccine is going to help to keep you immune and also transfer the immunity to your baby to protect from tetanus, because and your orifices, that your openings are actually exposed to the environment. So to prevent you from getting infected during childbirth, during delivery, this vaccine is given to you, to protect it from the bacteria, which you call Clostridium tetani, that causes tetanus. So all of these are the importance of antenatal care. So you can see the benefits of it for yourself and for your baby. So there is no reason, there is no excuse for you to skip it to your second trimester or your third trimester before you go do it. It's better for you to go and book register for antenatal care as soon as you detect that you're pregnant. Don't be that person that relies on Google, makes Google their friend, and replaces their doctor with Google, and then ask all their pregnancy questions from Google. Google is not your doctor. Ensure that you go to the hospital right on time and then get the right help that you need. So please try to keep your appointment, and also don't replace your doctors with traditional or medical doctors, that give herbs. And I'm really glad that even now they are well enlightened to know that their clients need to be referred to the hospital, because this is not really what they should be doing alone. Even if you want to give herbs, there are a lot of things that should be considered, because this herb sometimes can be harmful to the baby. So it's better for you, even if you still want to stick to your herbal medicine provider, make sure that you go to the hospital and always consult your doctor before taking anything into your system, into your body system during pregnancy. It's really, really vital. So you need to be extra careful. So this is where I'm going to be drawing the curtain today. I hope that this video actually stimulates and encourages you to go register for your antenatal care at your clinic or hospital. So my name remains Nima. You can call me Dara. I'm a medical laboratory scientist. Keep it locked on this channel. Subscribe if you haven't. Also like and share. Leave a comment, ask the questions. It's going to be fun. Bye.